am very excited to present today's webinar to all of you. And I think we pick a topic which is so close to our heart, so close to home: women, hormones, and health. And hormones play such an important part of our journey of our body, right from a young age to getting our cycles, to fertility, to perimenopause, menopause, all of that. We'll try and touch all elements of hormone, but today I'm very excited to present two amazing doctors here with us. Both of them super experts, super knowledgeable in their areas of expertise. And I think between the two of them, we can answer all questions, right from fertility for a young woman to perimenopause and menopause for the elder ones, right? Dr. Sreelatha comes from Almond Blossom Fertility and Wellness Center. She is a highly respected fertility specialist. She's known for her patient centered approach to reproductive health. And through years of experience, she has helped countless women, countless couples become parents through their fertility journeys, both as a combination of science and wellness and empathy as a part of the journey. Dr. Rajul needs no introduction. I think she's been with IWD since we kind of started years ago. We are so proud to be a part of her journey. When we saw Dr. Reset by Dr. Rajul coming together last year, it's a beautiful journey that we look up to, and so many of us look up to her as an inspiration. And her work in women's hormonal health, overall well-being, focuses on helping women understand the deeper connection between hormones, health, lifestyle, and all things wellness. All right. Thank you so much to both you doctors. Thank you so much for accepting our invite and for this wonderful webinar. We're looking forward to a conversation where we dig deeper into a lot of insights regarding women's health. Are we ready to get started?
Absolutely.
Yes, Reema. Thank you so much. Thank you for having us, firstly, and thank you, ladies. Um, the title itself. I used to live in Riga before, and today I see this, and there's a WhatsApp community for the women there, and I see this pop up there, and I was mighty impressed because of the reactions, like everybody, hormones, oh my god, then we need to be there. That was the reaction. So we basically built of hormones, everything. Hormones define us. So I think it's a very essential topic for us.
Thank you. Thank you, Reema, so much. And Dr. Sreelatha for sharing this forum with me today. I'm really honored to be on this stage with you. Thank you so much. And IWD and IWN, I'm forever indebted because I found this community, amazing community over here. Thank you again.
Wonderful. Thank you, docs. Let's get started. So, all right, everybody in the audience, I think we have 65, 70 people here. Can we just activate the chat box? Because I have a few questions for the docs. I'd love to start with them. But I do want to take up everybody's questions. So say hi in the chat box. If something pops to your head while the doctors are talking, please pop the question in the chat box and we'll come back to it so that we have a good, fruitful discussion for the next 50 odd minutes that we're together. Sounds good? Can we all say hi in the chat box? Let's just make sure it's working. It's active. I want to see your highs, guys. Let's say hi in the chat box. Let's say hello. I can see Namita. All right. First question, doctors. Actually, this is to both of you. I would love to get your opinions, right? Why do so many women still feel very confused or disconnected with their hormonal health?
Dr. Sreelatha, would you like to go first?
No, I'll wait for you, doctor, because
okay.
I'll take it from there.
Okay, so I personally feel that the biggest reason that women feel so disconnected from their health and from their hormones particularly is because they have been taught to normalize discomfort. I feel that they're completely, every time from a younger age, you hear people saying that your periods are painful. Okay, just take a hot water bag and it's okay. It happens. It happens to me also. Then mood swings. Someone gets angry before their periods. It's okay. Just calm yourself. Go sit in a corner. Talk to somebody. It's just made so casually treated and, normalized that people feel that this is normal and they don't want to talk about it, and that's why they feel disconnected with actually finding solutions or finding an answer to their problems. Also, weight gain in the perimenopause, the older woman, the middle life, okay, it's everybody takes it for granted that that middle life belly is okay to come because you're becoming older. Age, yes, you're going to age, but you don't necessarily have to be stuck with that. So instead of asking why women adapt, I would actually say hormonal health has traditionally been, not disregarded. It's only been seen as something related to their fertility, to their reproductive age, to their periods. They don't realize that in reality, it actually has a huge regulatory mechanism for brain function, for metabolism, for mood, for energy, and for long-term disease risk also. So I think it's important that women start asking questions when they don't feel okay, start listening to their bodies and asking questions, because they should not normalize it.
Wonderful. Dr. Sreelatha, would you like to add anything here?
Yeah, I mean, our menstrual cycle, as we know it, is classically defined as a hypothalamo pituitary, which means that anything that affects your brain in terms of stress, sleeplessness, you know, that affects your entire system. Your thyroid hormone and your ovarian hormone all work in sync. If most of us can recollect, I think when we were younger, maybe even some of them now, if you have had fever, if you've had an antibiotic, if you've traveled, your cycles go haywire. If you look back at your exams when you were younger, it would either be delayed or would be heavier or would not come or come early, which means that everything around us also influences how our system works. It's like Dr. Rajul said, we're not trained to listen to our bodies. We are told that it is okay. You feel tired, it's okay. My head, legs, my feet are cramping, it's okay. During a period, you're having severe lower abdominal pain, it's okay. Like doctor said, you just take a Panadol, it's fine. You have irregular periods, no, it's because of your weight. Go and fix that and come. Or you need to just work on your diet. Recently, when they actually renamed PCOS to polymetabolic, I was thinking it's time that somebody gave it attention, which means what I'm trying to say is our entire body works together with our hormones and they're interdependent. It is, we don't, the uterus and the ovaries don't work isolated from the rest of your body. Everything that affects your body and your mind, when I say the mind, the brain, actually influences what you are going through. Your hormones are dependent on what you actually also take in. I keep saying it's epigenetic, along with your lifestyle, what you eat, drink, and sleep with. That also matters. So it's a huge spectrum, if you ask me. And the word hormone, for some reason, scares women. They think it's too complex. And part of it is because I think we haven't been able to have, firstly, an honest conversation about it. We've not been able to explain it. For it is like, you have our olden text, which is in Sanskrit, more complicated. Nobody has actually been able to put it out in small snippets so that it is easily understandable to people. So that's why I think people are still, I think, wary about hormonal health, basically.
Thank you, Dr. Sreelatha. I want to pick on this, and especially regarding fertility awareness, right? From some of the conversations we've been having, I've learned that fertility isn't just about age, right? It's what are some of the things women should know early in their career, early in their age around reproductive health?
Again, I'll take it from my previous answer. Listen to your body. If you're not having regular cycles, your body is speaking to you. If you're having heavier cycles, your body is speaking to you. If you have painful cycles, your body is speaking to you. If you have vaginal discharge, which you would think is either foul smelling or, you know, is offensive and is itchy, your body is speaking to you. If you're married women and you have painful sexual intercourse, again, it needs attention. If you are having hair fall, dry skin, if your body is speaking to you in terms of there must be something in the thyroid level which needs attention. So these are things that we actually don't pay attention to when we're younger. We're told it's okay, bal gir rahe no, tel laga lena, it'll be fine, or change the shampoo, it'll be fine. There could be something else under the surface, and that needs to be addressed. So if you can take care of this early on, most likely you wouldn't be walking into a fertility office. The reason being that you kind of address almost all the issues. It's like a puzzle box, right? The entire mechanism. So if these pieces of the puzzles have been fixed early, you wouldn't have a problem which needs to be solved to a large extent. I mean, there are certain conditions like, let's say, severe endometriosis, or it's a male factor problem. Then definitely we need intense attention from the fertility side. But if it's just purely just about hormones, it can be fixed easily by a few changes much early on.
Wonderful. Thank you, Dr. Sreelatha. Dr. Rajul, I want to talk little bit deeper into this with hormonal imbalance, right? A lot of the people say stress se hota hai, anxiety se hota hai, right? What are these, what are the everyday signs other than what Dr. Sreelatha has mentioned that we should not overlook beyond just periods, periods of pregnancy, you would say?
So I would like to say that hormones are not physical. Remember that. They are deeply neurological and emotional regulators. Okay, I hope you all understand what I'm saying, that it's not got a one simple action where it works on like the ovarian, or hormones will work on the ovary, or hormones coming from the brain, they're just going to work in the brain. No, they work in all directions between the brain, the adrenal glands, the ovaries, and also the gut plays such a big role in managing all of this, because your hormones are being regulated in the gut too. So gut health again is playing a major role. So imbalances can show up as unexplained anxiety or irritability and anger. Then it can be low motivation also, that can be a hormonal imbalance. There can be brain fog. Also, your response to stress, how you tolerate stress, is related to your hormonal imbalance. Just to give you a few examples, it's like patients that I see in my practice normally would tell me, because, at Reset by Dr. Rajul, I delve deep to ask multiple questions that are not just related to signs and symptoms. So there will be people who say they get up, they sleep well, but they are tired when they get up. Okay, that in itself is telling me that something is not right. Then there are intense sugar and carb cravings. Okay, you feel wired all the time and you're exhausted. Then you have mid-cycle mood changes. Some women can actually come and they say that their husbands literally tell them, you've changed, you've completely changed in the second half of the cycle. Okay, and also there is that stubborn belly fat for certain women that just doesn't go, even if they're doing exercises, they're watching their diet, everything. So then we need to delve deeper and find out what is it that is causing this. So when you turn around and look at all of that, then you want to see that you are listening to your body. Remember that your body is talking to you all the time.
Thank you, Dr. Rajul. Thank you for the insights. Okay, Dr. Sreelatha, coming back to you, I can see a few young faces in the audience. Some of them might want to conceive in the future or might be thinking about conception. Let's talk that if they are planning to have a baby, what are some of the important things they need to start? And the baby could be in the future, at some point in the future. What are the important things we need to start paying attention to today?
From age 25 onwards, I think the most common thing that we've been seeing of late, and I think most doctors will agree, is dropping AMH. AMH is like a biomarker which tells us, your strength of your ovaries or your ovarian reserve. In simple terms, it's like your fuel gauge meter, which tells us how much gas you have and how far you can drive with that. most of us have been like, trained to be academic, achievers, professional achievers. So we have not been trained to think that, our reproductive health is something that matters as much. But I'd like to see that, and it comes as a shock when they walk in and they suddenly see their numbers low. Because let's say they were all the time getting 100 on physics, math, let's say accountancy, 100, whatever. And then suddenly they say, this is a number. It hits them hard. Sometimes they're in denial. And I think Dr. Rajul will agree with me on that. They somehow can't accept that their body has deceived them. It's not that. Every body is different. Everybody has its own imprint, like how Dr. Rajul said, it affects us at every stage. But if we can all understand where we stand with a simple blood draw as far as women are concerned, it becomes easy. It's important to be aware that in case you're planning pregnancy, a simple ultrasound with your doctor at any point as part of your health check, getting your AMH, which is an anti-mullerian hormone, which is a simple blood draw, and encouraging the spouse or your partner to actually have a basic semen analysis actually shows up some red flags. If there are too many red flags, then you don't necessarily, I'm appreciative of the new generation that's coming in. There are people who walk into our office now and say, doctor, I'm planning, this is my plan, this is my financial plan, this is my life plan, and this is my, 5-year plan that I have. And I'd like to make embryos and keep it in store. I'm planning to move to Canada, let's say, and the paperwork is going on. Once I move to Canada and once we settle, we'll come back for our embryos because the embryos are going to be much younger. And right now I'm a little more stress-free. I'd like to get it done. That is like, banking for the future, like how we always save for, financial future. It's something that they're doing for their financial future.
Egg freezing or something different.
This is embryo
this is
freezing for
different.
marriage.
Freezing.
And if you are single, it's egg freezing. So if you are at that point, you've done a simple blood draw, your AMH is on the lower side. If you have a conversation with your gynecologist, I'm sure they will encourage you to actually bank something for the future, especially if you do not have any marriage plans immediately. If you're married and you've been trying for, let's say, 6 months, nothing's happening, just go in, get this basic work, blood work / the semen analysis done, know where you stand, and then go forward from there. If everything is good, then you can take your time. If there are more than 2 red flags that appear from this, you need to see a doctor and get little help. Most people think that every time you come to an IVF center, we're actually pushing IVF across. We are not. We're here to tweak with as minimal ways as possible. And IVF is on the other end of the spectrum. It is not always the must do. It is, I'd say, the end all of the entire thing. Most of our patients have had a simple tube flush and they get pregnant. 30% or 36% is the last month's stats that we have. We did just an IUI, 37% of our women were pregnant. The global standard is 15%. It's just that if you do the groundwork properly, it becomes easier to achieve these goals. And if people do not fall in, or have not achieved their goals with this, then comes an IVF. It's like, you can walk, you can cycle, you can take a car, and finally you have to fly out. The flying out is based on your emergency and the logistics at that point, right? It's exactly like that. So for the women out there who actually planning at any point, just get a simple blood test done. If you have painful cycles or heavy periods, get an ultrasound done, a thyroid test done, basic thyroid test. If you're somebody who have repetitive headaches, please get a prolactin also added to that. This is apart from like how Dr. Rajul said, there's a whole different spectrum, like your vitamin D, your iron levels,
Yes.
all matters. But
Absolutely.
yeah, this is like the most important 4 pillars. I'm just touching on them. Apart from that, just get your spouse to do a semen analysis. Sometimes it's very difficult when people walk into our office and when we tell them that you need to get a semen analysis done. My question is, so where are your reports, sir? No, I haven't done any reports. mean, they've been trying for 1.5 years, 2 years. They've gone buying OTC medications, and the husband's sperm test not done. Men account for 50% of the fertility problems. Men account for 50% of all the effort that needs to be put in as well. And secondly, I feel like, men need to be, women alone shouldn't be taking the blame as well as the heartache alone. They should be, and I'm not being feminist when I say this. Please, people think that I'm being very feminist. I think, they have their heartaches. Men are trained not to talk about it.
I think we don't ask men enough what they
Yes.
feel, which is another thing that I do regularly. So I think it's very important, whatever you're saying, Dr. Sreelatha, I completely agree with what you said about the embryo freezing, the egg freezing. Not many people know about it because they're not counseled well enough. So it's really something that younger people need to understand today. It's amazing. Yes.
When people save for, travel, we are saving for traveling. We are saving for, there's a new trend. I'm learning a lot from my patients. There's something apparently called the fire couple. That means they tend to retire early without being, so they can live life on their own terms. So, you're saving up for all this, and then suddenly this is there. So I keep saying, maybe we should have actually saved up for this as well. And that was something, I wasn't educated about this. Honestly, when I was in medical school, right, Dr. Rajul, we were not told about everything, and we were doctors.
We didn't have it at that time. Then even when it came, we were not educated, doctor.
We were not educated. And now I keep thinking the amount of options that's available is huge. It's just that, and I think from the society that we come from, we're not encouraged to speak about it more. Fertility. Interestingly, I had this young couple who came in from Tamil Nadu today, and they've been trying for 1 year and 4 months. They've been referred to me to do a simple IUI. And as I start talking, the girl just bursts into tears. And she's just not stopping. Her husband shocked. I'm not used to people crying at the beginning of the consultation. She just continuously cried. Then we had to distract her by talking about Coimbatore, because that's where she's from. Talk about the movies, talk about their new chief minister who happens to be an actor. It took 12, 13 minutes of calming her down, giving her water, and it was just that she felt her biology failed her. I think that's because there was not enough awareness that this can happen. I told her, when you have prescription glasses, she had glasses on. I asked her, did you actually cry when you went to the ophthalmologist and got your eye? No. When you had a broken one, in one of the history, she said she had a broken arm. I said, X-ray was taken, you did not cry. They put a plaster around you, you did not cry. They did not heal well, then they had to operate on you, you did not cry. Why this? There's so much of taboo, stigma, emotion, and personalization about hormonal health, and it's less seen as a medical condition. I think Dr. Rajul will agree with me that we don't see this as a medical condition. We think it's a personal condition. Anything
because doctor, I think what people need to hear is that you can manage your hormones if you're looking after your metabolic health, if you're managing your blood sugar, if you're managing, your vitamin deficiencies, your nutritional balance, all of that. I think if they're taught that, they will have a better understanding of their hormones, anything, rather than, I know we've not been taught this ever to look at it in that way.
Totally. So I feel like, counseling should have been the first step. I feel like, we should reach out to schools and universities and start from there and tell them your hormone. I was just telling Reema the other day, when people go to India, executive health check, mein kya hota hai? They do your CBC, that's your hemoglobin, they check your cholesterol, they do an ECG, they do a general ultrasound. At no point is your hormone checked anywhere in that panel. We need to have inclusions for that, and I think we could be advocates for that from here on. That
and yes, absolutely, doctor. And even where hormonal panels are done for women, they are not explained correctly, because there's so much of functional medicine that I follow. It has a complete different meaning when you want to heal yourself for optimal levels, whether it's for your fertility, whether it's for your management of any disease that you have. So that understanding also is something that people have to come forward to understand.
Absolutely. And I think webinars like ours are a step in that direction. We have 90 plus people here in the room today. I'm super excited to welcome all the new joinees and thank you for joining us. And I mean, look at the attendance. That tells us how important a topic it is for all the women. We also have questions coming in the chat box, which we'll start picking up very, very soon. So thank you. If you have a burning question to all the listeners, please pop in and we will definitely take all of those up. I want to move on to my next question is what we were discussing is that women experience a lot of things and they sometimes don't even realize. Let's talk perimenopause, Dr. Rajul here. And I think this is your sort of area of specialty. What are the some early signs that women should know about, especially when they are 40 plus? And some of these things don't get openly discussed about. So what's your view on that?
The first thing I'll say, Reema, is that you said 40 plus.
What,
It's not,
what age? What
it's
age
not
does
40
that start?
plus.
Yes.
Perimenopause is a transitional phase. Sorry, I'm extremely passionate about this, so I'm going to
Please
sound
go for it. That's
spiritual.
why we have you here.
So it's a transitional phase that women go through nearly 10 years before they hit menopause. And the thing is that we don't know when we are hitting menopause. It could be anytime between the age of 45 to 55. So if you're going to become menopausal at 45, then at 35, you were perimenopausal. So what will tell you that you're in perimenopause? There is no marker or there is no specific, testing to tell you this is perimenopause, because this is not, it's a transitional phase. It's not one thing like menopause. You can tell once you have no period for 12 months, then you're menopausal after that. Here, you just have to wait till you hit menopause to be told that that was your perimenopause, basically. So the first thing that people will see is an irregular period. This is the first thing that we see. Now, there are many other reasons also why that happens, and that's why going to the doctor, if your period is irregular, that means it can be. I've heard women come and tell me that, yeah, once in 6 months, once in 7 months, I've had an irregular one period, just one off. Well, that is the first sign of perimenopause, because the first hormone that really goes down is progesterone. And that is the reason why this happens. Okay. Then there are other things like you'll see like unpredictable bleeding, heavy bleeding, even if your cycles are regular. This can also be because of a progesterone decrease, and that is a sign of perimenopause also. Then new onset mood swings, okay, which you never had before. Those are signs of perimenopause. Or you could have anxiety that you never had before. Now, many people relate this to, like in current times, when you look at it, you have the war, you have career related problems, you have job related problems, you have small children growing up, or you have teenagers who are in college, you have multiple other problems. And then you have your husband also who goes through midlife crisis, and you don't know who to pin the problem to and tell somebody that this is the reason why this is happening. In that whole thing, in the process, you actually don't realize that you are also having your hormones going down, and maybe this is because of your hormones and not because of the other things that are around. So that also needs to be looked at. Then sleep disturbances. A lot of women tell me I need to wake up to pee at night. Okay, this is not normal. All right. You should not be waking up if you sleep correctly and your cortisol is properly managed and you have your sugars are managed properly. You should not be getting up in the middle of the night to run to pee. So waking up around 2 to 4 o'clock in the morning, not being able to go back to sleep. These are again signs of perimenopause. What happens in perimenopause because of hormonal imbalances? Then weight gain, a gentle weight gain, which is not related to any lifestyle change. That means the person tells me I'm going to the gym, I'm going and I'm eating also the same things, and still my belly's not going, or I've put on 2 to 3 kilos in this year and I'm not happy about that. Especially women who manage their weight properly will be very, very particular about it. Yeah, I know, Reema, you're part of that. That's why I said that. And then the most important is reduced stress tolerance. Like you'll be driving and for no reason you'll be angry with somebody cutting you, and then okay, it doesn't stop at that. You bring it home with you. You think about it 150 times and you say, this man did this to me, I should not have allowed him to go ahead. Or this is just one example that I'm giving that can come in every region of your life. You could be intolerant of somebody just doing something normally also. These are hormonal imbalances, and anger management is part of that when you have to look after that. So most of that, the symptoms are very subtle, but they are there. And you need to understand that you need to manage. The doctor mentioned PMOS now. This is the new PCOS, and I'm so glad it's come out. I've been treating my patients for more than 12 years in my functional purview, getting their metabolic health into, the picture. So polyendocrine metabolic ovarian syndrome, this itself says that you have a multi-endocrinological level metabolic disease that is linked to your ovarian function, and that causes this problem. So managing metabolic health, managing sugar problems, all of which is what I help my patients with. Even if they are people who have to go in for fertility treatment because they waited too long. And nowadays we do see a lot of women who are career oriented and who don't want to have their babies. When I had my baby at 38, in that time, I thought it was so late. Oh my God, I thought it's really late, kind of. Okay. But now you see more and more, and that's why they need to be better prepared. Their bodies need to be better prepared. So that's my
Thank you, Dr. Rajul. Guys, just making sure everybody is there. Give me a thumbs up if you're still there in the session. We are loving all the questions coming up. We actually have some very good questions in the chat box. I'm going to take them up now, doctor. I think the first one is for you, Dr. Sreelatha. This is from Gayatri. Gayatri, feel free to unmute if you are around, and but I'll read out the question now. What's it? All right, I'll read out the question and you can add more context. What if a person is planning to conceive and she has a combination of cholesterol, uric acid from the father's side, and symptoms of cancer from the mom's genes? Do they have to take any medications?
Firstly, I think it depends on the uric acid is not a genetic condition. Okay, it's more a lifestyle condition to some extent, and that can be fixed very easily. So if the father has uric acid and cholesterol, both are lifestyle diseases. Now, coming to cancer, it depends on what form of cancer. If it is on the maternal side, okay, and if it is going to be linked to either the breast or the ovary, the woman should be evaluated at regular intervals with her OBGYN as early as
mouth cancer.
Mouth. No, don't worry, dear. I don't think that should be part of your reproductive. I mean, that's something that's passed with them, with the previous the generation. It is not going to come down to the woman at this point. If she's planning to get pregnant, I'd say is just have your regular screenings done, which includes your pap smear, your breast health with your local gynecologist. Make sure you do an AMH done, depending on what age people tell me. Is age important? Age is definitely important. Like, when Dr. Rajul caught the 40 plus, I'm saying the same thing. We do think age is important, but does age alone define your fertility? Not necessarily.
Okay. What kind of AMH is needed, though? What is a marker of AMH? What is the minimum?
Yeah. See, AMH alone, I say there are 3 A's that define a fertility of a woman. One is the age. The first A is the age. The second age is the AMH. And the third age is an ultrasound-related marker, which we call the antral follicle count.
Yes.
These 3 A's together define how potent your ovaries are. Now, there are patients who, interestingly, there are women who walk from different parts of life into our office, right? There are women who are 38 who've been yoga practitioners for such a long time, eating very healthy, coming from, let's say, Rajasthan, and have just moved in 2 years back to Dubai. And interestingly, I see that it is easier. I think it is the lifestyle when they were younger that they dealt with, local produce, a less dependency on all the other packaged food that we all
Yeah,
are.
processed foods.
Yeah, that we have. I get to see, and there are people who actually travel internationally and they come in for what is very sweetly called family balancing here. That is because they have, let's say, one son, they want to have a daughter, they'd rather have through IVF. So we get to actually tell them that there is what the gender of the child is as well. So, and that's not legal in India, so they travel here. I don't have time to research, but I'm getting to know places in India because of that. Like, for example, I didn't know that there was a place called Reema in Madhya Pradesh.
Mhm.
I had a 46-year-old professor who walked in and told me that they'd like to do IVF. And 46, is taboo in fertility. Well, we like to touch them with a barge pole, honestly. I said, your chances are going to be less than 10%. And they said, when we're 53, we don't want to look back and think like, hamare paas chance tha, hame knowledge tha, and we didn't try it. So interestingly, I collected only 3 eggs from that woman. 3 eggs is all I got.
So 3 ka AMH. हाँ.
AMH kam tha, bahut kam, okay? 3 eggs, and they had 2 healthy embryos. And
Yeah.
she is like, I keep telling that, so this theory about age defining fertility is not 100% right. That's why I say it's a complex thing. It's an interplay of your genetics, it's an interplay of lifestyle, what you eat, what you drink, how you've dealt your life the last few years. That actually matters. Apart from that is the 3 A's that I said: your age, your AMH, and your antral follicle count. So these 3 things actually, so going back to what Gayatri did ask, and what you've been asking, age does not define us alone, but it is a combination. Jaise khichdi banti or a hot pot banti hai, you have to have everything in the right, portions.
Lots of
And
ingredients.
lots of ingredients and in the right proportion, and you will get your results. People,
Yeah, I'll just add one more thing, doctor, to what you said. I think what Shweta was hanging on to about AMH is only your fertility reserve. Remember that. The quality of the egg, I think doctor clearly said that she had 2 beautiful embryos, because if the quality of the egg is good, correct me if I'm wrong, doctor,
yes,
then that matters more than your AMH also. Yes, your AMH will tell you have so much time or you don't have so much time, or you should do this quicker or you should wait. It'll tell you that. But the quality of the egg matters more than anything else.
Wonderful. Thank you, doctor.
So in IVF,
I'll simplify this.
Yeah,
It's
go
like
for
your ATM card. It tells you what your bank balance is, so you can budget yourself for the rest of the month. This is the AMH is your ATM card, which tells you how to balance your, how to prepare your budget for your reproductive health. It's as simple as that, if I could make it simpler.
Yeah, doctor.
Yeah.
Wonderful. Thank you, doctors. Our question boxes are flooding. You both are clearly very much in demand. So I am going to move to the next question now. I think this one, we'll start with you, Dr. Rajul. Devang Chadda, if you're here, please unmute yourself. He's asking if you're having periods at the age of 52. Is that fine?
Yes, it's
totally.
okay.
And both of, I'm sure both of us unanimously agree that it is fine.
Yes. Because 51 is the average age at which you have menopause, and some women do get it up to 55. See, I told you the range, 45 to 55. So it's okay. But again, having said that, if there is an irregularity and as we're talking about, women should not shy away from regular annual checkups. Okay, so you don't miss anything. Your pap smears, your ultrasounds, your regular nutritional vitamin deficiencies, your sugars, everything, your hormones need to be tested. Okay. you cannot skip that and say, okay, Dr. Rajul said it can be all right to get it at 51, so it's all right. No. Once a year, you're you need to come in and see your gynecologist and do just everything. Don't you go out on a Sunday or at least once a month and eat and have fun with your family? You go out and treat yourself. Yeah. So
Yes.
once a year to do all your tests is not too much.
Doctor, can you recommend test for ovarian, cervical, and things beforehand, just in case? So anything along with the annual, like we do our pap smears and all that, but for our breast and
So
for
you need to have a regular breast examination
a
once a year.
mammogram.
A
Yeah.
mammogram is only after the age of 40, and let the
Okay.
doctor decide that when they see you. Then go in for your regular blood tests, your regular ultrasound, and your pap smear. This will tell you about your ovary, your cervix, your uterus, it will tell you all of that. And then,
Okay.
Shweta, everything else is personalized when you come in. Okay?
Sure. Yeah.
Yeah.
Yes, doctor. I know I'm your patient
What about
doctor.
after menopause?
Yeah. After
Okay.
menopause,
Yeah.
sorry.
I said, what about after menopause?
Same way, same way. Do you stop living because you become menopausal? Today, women are alive right up to 80, 90 years, which 100 years back, they were living only up to 45, 50 years. You're living half your life in menopause. Why would you not look after yourself? Why?
So the same test we should do
Same.
yearly,
You have to
right?
come in once a year. It is not the same package for everybody. I think Dr. Sreelatha also mentioned before that you go and you do your annual executive checkups that are just made as a guideline for somebody to do regular stuff. When you go and see the doctor, you should have personalized testing advice to you as to what you require after taking a history. That's important.
Thank you.
Thank you, doctor. Let me move on to the next one because we have a flood of questions for both
Yes.
of you. I'd love to take as many as we can before we wrap up. Okay, Dr. Sreelatha, I think next one we'll start with you. This is Shruti. Shruti, are you around? Shruti Anantwar. Hi, doctor. How to manage inflammation in endometriosis while trying to conceive?
Endometriosis per se is an inflammatory condition. Firstly, let's start from there.
Mm.
Why does it happen? It's like you have the uterine lining, which sheds out as your period every month. When this uterine lining is sitting in an abnormal place, so the region around that actually feels irritated and there is inflammation there. And this ectopic or abnormal placement of your endometrial tissue is what is endometriosis. And how was it categorized? How do you know it is endometriosis? By painful periods, by painful sexual intercourse, by heavy periods. And it is quite normal, like doctor was telling me, the first thing she said was, we tend to normalize the period pain, even when you're young. It's so unfair to normalize that. And the way to go about handling this would be for your doctor to pick it early on and put you on one, lifestyle changes to some extent helps. Second is anti-inflammatory, and I think Dr. Rajul, who's doing functional medicine, should give you a little
Yes.
inputs. Then there is something called NAC. Okay, NAC is an acetylcysteine, which they say has been helping reduce inflammation. It's up to 600 milligrams. The third thing that they're saying is antibiotics with probiotics helps. And the last thing is they say that, progesterone, adding on progesterone. And, the more periods you have, the more your endometriosis is going to get inflamed. So progesterone is being used as therapy during the time you're not planning conception to keep the endometriosis under control. Remember, endometriosis keeps spreading. It can spread, eat up all the ovarian tissue. The reason why progesterone is important is because it keeps the endometriosis growth lowered. Endometriosis is estrogen dependent. So every time you're having a cycle, estrogen is produced in your body, and that's feeding the endometriosis. What can be done is put progesterone in, suppress that, and that is what doctors do, including functional medicine doctors. And what they do is they put the patients on these supplements. When you decide to actually conceive, then they decide. Most of the endometriotic patients usually end up doing an egg freezing or an embryo freezing prior to any kind of surgical intervention, because sometimes surgery is offered as a treatment for endometriosis, but when you go in, you end up damaging the ovaries, which are very fragile, and the tubes, which are very fragile. For most people, the current guideline is to freeze the eggs or create embryos before you attempt any form of surgery. But prior to that, these can be managed symptomatically with these recommendations. I go back once again. You can consider taking NAC as a supplement, take probiotics, preceded by a course of antibiotics. Then comes taking, lifestyle changes, and then under medical supervision, going on fertility. Yeah. So
Wonderful. Thank you. Anything to add here, Dr. Rajul? All good?
So as Dr. Sreelatha said, anti-inflammatory diet can help. It's not the answer to the therapy, but it can help because it can reduce your inflammation in your body. So where that is concerned, and even what she mentioned about the supplement, and I would like to say only one thing. Don't self-medicate yourself with any supplements, because you may think this is only a supplement, but overtaking supplements also can cause major problems in your body. So make sure you have medical supervision whenever you're doing anything for any disease or any problem.
We
Thank
need
you.
to
Thank you,
recheck
doctor.
for
Uh,
inflammation.
You have
sorry,
to come on
moving
my
on.
program for that.
Yeah. So yeah, I would like to plug in. Both the doctors would be very happy to see the patients. Dr. Sreelatha has kindly offered free consultations on Friday at Almond Blossom Fertility and Wellness Center. And Dr. Rajul, I'm sure will have special offers for our
Yes.
community, which we can
I
always share. So please,
I want
guys,
to
book your appointments now while the offer is on, right? So there you go. I want to move on. I want to still take on questions because we have the last 9 minutes.
I want to say something. That we can save umbilical cord also after
yeah, the
the
cord
birth is
cells,
given.
the
Yeah,
stem cell.
because
Yeah.
nowadays so many diseases are there. So there are many companies who save them for years. So you can just freeze them and they can be used later.
Great. Thank you,
You,
Dr.
Dr.
Sreelatha. Dr. Seema is it? Thank you, Dr. Seema. Thank you very much.
Yeah.
Awesome. Let's move on to the next question. I'll let you both decide who wants to take this one. But this is from Vinita. Vinita, are you around? Just unmute yourself. What about teenagers having acne problems on their face, head, and back? Do we worry about that, or is this something which will be fine as they grow old? Very valid
That's a
question,
different
right? Because
question
yeah.
though. Different question though.
We've
But I just
been
want
told about this, and that's why we are where we are. So I think we should not be telling. And I was planning to tell this to all the mothers out there: please do not normalize
Yes, I will also
teenage
say the
acne.
same.
Yeah, don't normalize period pain. Let's empower our daughters with at least knowledge that we can give them. So for me, I wouldn't normalize this. I would definitely get two people's attention. One is, I think most teenage girls don't want to go see a gynecologist because they think it's taboo and it's for the adult women. So, but you can walk in with your daughter and have a chat with the gynecologist. Second is the
a
dermatologist.
dermatologist or a
Dermatologist.
Yeah,
gynecologist.
the
problem. I
dermatologist.
think
And finally would be, you can see an endocrinologist or somebody who practices functional medicine, because that they can
Yes.
actually help us.
I would definitely recommend a functional medicine gynecologist, because I think teenage years are a good year for them to come and understand why it is important to look after your, just, come and take your blood pressure, talk to somebody, understand your periods. It's just a stepping stone. You teach them about menstrual cycles, right? How to use a pad, how to do all of that. Then why not teach them all of this also? So absolutely come in for a consultation.
Thank you, doctors.
Thank you.
Moving
I
on to
wish
the
we had doctors like you when Reema and I were like younger, 20 years back.
Well, I
I
hope
wish
can
we had
say,
IWD then to
I,
organize this.
I can say only one thing, that I hope we can help more people, Dr.
Sure.
Sreelatha and me now,
Yes.
for those
Yeah.
who need help.
And before,
Yeah.
yes, totally, doctor. Yeah.
Great. One last question, doctors, before we do the closing. And I guess there's actually two questions which I think kind of have an overlap. So I'll read out both of them. Kanchan is here, Kanchan Balchandani, and she has a question: how do youngsters prepare if they want to conceive later, not immediately after marriage? And then Rita Jivani, if you are here, she says, "Hello, Dr. Sreelatha. I wanted to inquire about egg freezing. I would like to understand the process, the ideal age, success rates, test required, cost in Dubai." There you go.
Also,
I'm
also
very
to add to egg freezing, when we do IVF, Reema, I'm just extending this so they can answer
Hmm.
together. So
Yes.
when we do like an IVF, so like at 40, let's say I get an IVF done. So I mean, I already have a son, and then most of my IVF friends have got like twins. So I don't need a twin at this point. So how does that work? Sorry, yeah. So just to add to that,
Okay.
thank you.
I'll just go one by one, and let's go with the first question. How can we prepare our people for preserving their fertility? If they are young married couple, like I said, they can do embryo freezing. I have a doctor's daughter and husband who are here. The mother is a gynecologist. So she said, both of them are working in the finance sector here, and they don't want to have kids anytime soon. They've got their own life goals. So the mother dragged them in, got an AMH done. AMH was 1.46. The mother told me, convince them to do embryo freezing. I said, I cannot convince them. I'll have a discussion with them. The husband was sold on the idea, and they're coming in next month to do an embryo freezing. When and how they are ready, they will decide. Now, there's another couple who walked into my office sometime back for egg freezing, husband and wife together. So she said, we want to freeze eggs. So I said, since you're married, why don't you consider freezing embryos? Because egg is a single cell, and this embryo is like almost 500 plus cells. So they're much more stronger when you freeze them. I mean, I admire the generation that we are in. She, without flinching an inch, she said, what if I am no longer married to the same guy? Rather freeze my eggs than my embryos. And I thought that was women empowerment at a different level. And the thing is, the guy didn't flinch. So
Yes.
I'm very appreciative of the generation that we are in, where, the boys are respectful of the choices that the women are making, which is actually so important.
Or they
Actually,
see it coming
this
anyway.
is so good, Dr. Sreelatha, because even I've seen patients who have
Yeah.
taken decisions not to have any baby because it's their choice not to
Yes.
do that. Not because
Yeah.
of some problem or because there is a medical reason or anything. And the couple is tuned perfectly in that. So I think the newer generation is far, far
Very, very,
better.
very, very
Yes.
appreciative of that.
This was my, allow me to say, excuse me.
Yeah, yeah, please go ahead.
This was my question. I'm Rita Giovanni here. This was exactly my question. My question was actually related to my daughter. And, being a mom, I feel it's so personal. I mean, I feel it's very personal to ask my daughter the question that why she doesn't want to have kids. And I had this lovely opportunity to ask here. And I'm sure, I was a bit reluctant to ask this question actually, but I've always had it in my mind that why, like we've grown up with when you get
Yeah.
married and you're going to have children and like
Yeah,
that's,
it is.
that's a normal,
That's normal.
yeah.
Yeah.
So, but when
There's a new normal.
Yeah,
I
there
think
is a new normal.
I feel I literally cry inside. I feel so shocked that when you can have kids, you had the privilege of becoming a mom, and then you say that you don't want to have kids. I deeply cry inside. But my question here is that I wanted to ask. I've always spoken to her. I've come to a point now to speak to her that why you don't want kids, and
Yeah.
I haven't spoken to my son-in-law actually, but I've spoken to her a couple of times, but that makes her so irritated. And I feel
Because-
that she's just going to run away from me, So
Can I say one thing to you?
No, I stopped asking questions. And
Rita, I just want to say one thing to you because I
Yeah.
see you so agitated over this, and I want to tell you
I
this.
swear I
Really.
am.
I
Dr.
want to
Mahajan.
hold you and tell you something. You have
Yeah.
to respect her wishes.
I am.
She is not, no, no, listen to me.
Yeah.
She is not you. If we thought having the baby was the most important thing, for
That's right.
me, I'll tell you why I relate with this, because for me, it was the most important thing. I had one miscarriage in my first year after my marriage, and then I didn't conceive for 11 years after that. I had 3 IVFs that failed, 7 IUIs that failed, with beautiful, Dr. Sreelatha had 4, 4, 5, 5 embryos every cycle, and nothing worked. And then at 38, it was a normal conception when I had let everything be. So it's a decision that she and my husband used to tell me at that time that, listen, you're not probably made for this. Don't run after this. So
Yeah.
everyone feels differently. So you should respect that. I know it
I
matters to
respect
you.
it. Yeah. I
But
respect it
maybe
now.
they are not physically and mentally ready for this. That's why
Yes,
they're
yeah.
telling
So
you this.
I've also been there, done that. My fallopian tubes were blocked actually. And my daughter is a precious baby, So I've been there, done that. Everything is done. But as a mother, I just want to ask.
Yeah.
I don't ask them anymore. I think it's a personal choice now. But as a mother, I'm just asking this question: what is the procedure out?
Because even if you counsel them, even if they are
I
counseled
don't want to.
well,
I don't want
no,
to.
no, no, no. I don't mean you. What I
Yeah.
mean is, even if they're counseled well professionally and they're unprepared and they're doing it only to please the family, believe me, it'll bring a
Yeah.
lot of heartache. So better they take
Yes.
the decision.
I agree with you. I agree, Dr. Rajul, with you. I agree.
So that is why I
Um,
tell my mother she's so blessed she has a millennial child. We never had a place to question. Reema will agree to this.
I
जो बोला करना
Another
है.
thing is give them the options. I
Yes.
also tell people that we don't want to have a place for regret. Some of them,
Yes.
that is where the egg freezing comes in.
Yes.
yes.
We
Yes.
don't want to look backwards and say, okay, I wish I had that option.
Yeah.
I didn't know that option existed. There are a lot of people who travel from here to Europe for these options because suddenly they're suddenly aware after coming here that egg freezing is an option.
Yes.
Mm.
So, and that by then it is too late. They've done an aim at 0.46. They panic. The next thing they go because they're already like 40, 41. So it is important for them to be aware that there is an option. They don't necessarily have to use these eggs. It is a what if option. It's like I said, saving for a rainy day kind of an option.
Yes. Yes.
So,
Yeah.
maybe egg freezing is something that we need to put outside more. It's your choice at the end of the day. If you do want to and not happening naturally, you always have. You don't have to say, oh my God, you've missed the bus. So we shouldn't be letting them feel that they missed the bus at any point. That's the reason why egg freezing is something I think is a conversation, not necessarily as a mom, you should be having, but somebody should have this. My daughter is 16, and after grade 10, for some reason, she just lost interest in academics. She did well in her academics, but she just wasn't feeling like giving her best. So she said, I don't understand why you have to study so much when, AI is doing everything today.
Okay.
I told her, yeah, I don't have to necessarily look at, she wanted to, she said, even journalism is not an option because AI writes the script, content, everything. So I said, yeah, look at blue collar jobs because I think eventually they are the people who are going in demand. And she walked off, and my husband was reading a newspaper, and I said, if she's not planning to do anything after 20, maybe I'll consider freezing her eggs. Because my daughter is polycystic or polymetabolic ovarian lady. So I know that for a fact. So my husband just dropped everything and said, are you not stretching it too far? I said, that's the best fixed deposit I would give her.
Oh my
Yes.
God. Yeah, I agree with you. Yes.
Yes, I agree
So-
with that, doctor.
So that was, a little thing that happened. People actually look at me and say, really, you had this conversation? I said, yes, and I'm seriously considering that because I'm knowing from where my daughter is, she's a very independent thinker.
Yeah.
Like the other day, when the US elections were happening, she was the first who said, no, this world is heading towards disaster now. And I didn't take her seriously. Now I keep thinking to myself, oh my God. So they all have the very strong viewpoints about everything on the planet. I never had a political viewpoint when I was 16, honestly. So,
I still don't have one, doctor.
All our daughters are
This is
very
what,
strong.
yeah.
Yeah.
My daughter is very aggressive. She's very aggressive. And she's very career oriented as well. So this is the reason
So,
why
yeah,
I
when we're talking about
this is the conversation exactly I did with her. I said, I said that as a mother, it's my duty to tell her that, at the end, she would say, Mom, you never told me this. She should not have those regrets.
Yes.
That's why I told her that this is what is happening and you got to do it. So now I had the opportunity to ask you the question. So I thought, okay, let me ask.
no, because it's
Doctor, can
genuinely,
you?
yeah. Sorry,
No,
yeah.
no, the IVF question though here. I'm
Yeah,
sorry.
and coming
before you
back
miss that.
to the
Yeah.
next part of the question, how does egg freezing work? Normally, our body is designed to produce one egg every month. Okay, under the influence of the ovarian hormones, along with the other hormones that are produced in our body. By around day 12, 14, or maximum by 16, you ovulate. If it needs an sperm, it fertilizes in the tube, moves to the uterus, takes and grows on to become a baby, provided the egg and the sperm are compatible with each other and they want to live happily ever after. This is how babies are generally made. Now, what happens in in egg freezing or an IVF procedures? We try to create more eggs. How many eggs that can be produced in each cycle? We try to do that. And how do we do that? Your egg starts growing from the first or the second day of your period, right? So from the second day onwards, we start giving you a little more of the FSH than what your body produces. So this goes on for 10 days. So if the body, like say we have an AMH of 2 nanograms, the body is expected to produce around 14 eggs in that woman. So we give you enough hormone to get those 14 to grow. Now, these are at this point, I don't want to call them eggs. These are still follicles, and we think the egg is inside them. Now, after 12 to 14 days of these injections, we go, I'm sure you've all seen what a transvaginal probe entails. It's an internal scan. We go via that route and we collect the eggs while the woman is sedated for a 5 to 15-minute period. The eggs are collected out and then we freeze them. What is the reason why most people stay away from it? One, they think like, oh, so many hormones actually are going to cause problems to my health later. Not necessary. Okay. Your body is designed to already produce these hormones. We're just taking it one notch up. That's it. Then the second thing is they tend to read that, oh, it can cause cancers. So far, data since 1960 this procedure has not caused cancer to women. But the people who have family history of cancer, these are the women whom we need to pay special attention to and use different protocols for them. That is the thing. Second is, when do we do egg freezing? Most of the time when women are running out of time, women are doing this as a choice. The third is when people are diagnosed with cancer. Now, when I go back, I'll just take you a step back. Last month, I had a 37-year-old young woman who walked into our office who has been posted for, I use the technical word now, a severe adenocarcinoma of the uterus, which is extended into the uterine cavity as well. And it started spread. She went in with irregular periods to the doctors, but she wouldn't let a doctor do an internal check because she was still single. Now she's reached, and no biopsy was done because she was not willing to go. So if any doctor suggests biopsy, she would just shift the doctor. She'd move to another doctor. So we've reached this point where PET scan, biopsy, everything is done. And the only way out is removing the uterus with the ovaries. Actually, it took me some time to absorb this because she'd just been given her diagnosis the previous day at one of the premium hospitals here. And in 5 days, she was supposed to go for the surgery. And again, what was our concern? I wish I knew that egg freezing was an option. We were trying to see if we could save her ovary. We called Abu Dhabi because I was feeling for that woman so much. I called doctors and I was like, can we do something about ovarian tissue, take the ovarian tissue? Because we don't have time to stimulate her and take the eggs out. So, and the doctor said the more we delay, the more the spread is because it was aggressive. There is, now we can actually collect ovarian tissue and preserve it and then, use it later. So, we tried to see if there were doctors who were, but they were all like, Srilata, I think we've run out of time for that option also. So what, again, I'll come back to where. So I just want to tell you this egg freezing is something like, again, I say, what if? Let's, please let's get that, to anybody whom we know. Now, coming back to the timeline, okay, we've done 14 days of injections, we've taken the eggs. Then what happens is the lab then freezes it and keeps it. The only downside of this, I think I want women to be aware is it can be slightly more emotional than normal. It's like PMSing into three. If you're PMSing for one egg, imagine you're going to PMS for three eggs. That's how it's going to be, which can be, handled, but that's the only thing. So people would feel a little more emotional than normal. They will feel a little clingier or more lonelier than normal. That is what is the only downside that is there in terms of the emotional part. The physical part, we're always here to take care of that. Earlier, UAE would not allow shipping of eggs to any other country, but now we've opened up and you can ship. For example, you've moved from here, you're allowed to move your eggs along with you with the MOH approvals. If you are you get married and in a year nothing happens, you can come back and then we defreeze these eggs. We call it the thawing process. And the thaw rate at this, like for example, recently I had a Russian woman who defrosted her eggs. We had collected 41 eggs over 3 cycles. Would come annually and freeze it. Now she found a partner and it did not work. So she came back to take the eggs out, 41 eggs. All the 41 of them survived the defrosting process. It was a male factor. So the fertilization was around 36 of them have survived and they're still growing in our lab as we speak. So that's the advantage. So if at some point you've frozen your eggs and there's not been natural pregnancy, we are always here with your eggs. You can always come and pick them and take them and, create babies from them. So
that's quite an information, actually. That's quite an information. We were not aware about it. Yeah.
Yeah.
Yes.
So at any point, if there's if I'm one of the women who asked me about egg freezing, I hope I've answered your question with the timeline of egg freezing.
Yes, you did. Thank you. Thank you. Thank you so much.
Yeah. So if there's anything else that I can clarify about egg freezing, I'll gladly do so. The other option for people who are, like I said, who are married and we don't know how life takes. I keep saying, there are too many twists and turns, but if the husband's on board, you freeze it as eggs. If the husband's not on board, as freezing as eggs alone, then you can freeze it as embryos. Again, as fertility practitioners, we like freezing embryos because it's more cells going together. It's like, when we were younger, we were told, no, unity means stronger, you can't break it easily and things like that. Lakdi hai, so you can put a fight faster, but when you have lots of them, it's difficult to break. Same scenario applies to embryos. The more cells, they go in together, they come out stronger. Single cell egg is a single cell. So when it goes on, we think that when you thaw out, sometimes, not all of them. Suppose I've frozen 20 eggs, sometimes only 18 can survive. So that's the only downside that's there for the egg freezing process.
And embryos, all of them survive. Like the rate is 100%.
Yeah, 99% of the time, all of them survive. And then coming back to this thing that you said, embryos, har bande ka twins hota. No, it doesn't work like that. It's like, if we put in one embryo at a time, you're going to actually have one baby.
Okay.
That's not guaranteed. A 72% is the chance of having that one baby if you put one embryo in. For people who have put in one embryo and has split into two, that is as equivalent to your chance as your chance would be of winning the Dubai raffle. Okay,
that's
so
21%.
That's how
way to say it. That's a good way to say it.
Yeah,
I'm
so proud, to see Doctor. This is Nidal here. I'm so proud to see you here. So she's my miracle worker, and both my daughters are her gift to us. She was our gynae. We used to go to her, and all the 1.5 years of the turmoil. Actually, it was preparing how she prepared us, and then how she was there to mentally support. It's a lot of pressure. She's doing the science, but then she's also counseling and helping us take the decision.
Thank you so much.
I really wanted to come back and And it's
That's
all,
true.
yeah. Thank you
You
so
know,
much for that.
Meenal would manage her artwork, her gallery, right? You
Yeah.
were doing a gallery and establishing and all this through that journey. It was not easy on her at that. And her husband was working in Abu Dhabi. Correct me if I'm wrong.
Still,
Still in
yes,
Abu
still
Dhabi.
he is.
Okay. So my memory is still,
Yes,
still functional.
and
So
I'm so proud, and I felt so overwhelmed when I saw that you're going to take this session. I just finished my training session, and I've come only to say hi to you,
oh,
and
thank you.
yeah,
Thank you. Thank
come
you,
and get
Meenal. Thank you
connected back
so
to
much. It
you.
means so much. Thank you. Thank you so
Yeah.
much.
I
Wow.
think it's the trust that we have in our doctors. That also is one reason
Yeah.
that helps, because everyone
Yeah.
had always told me this. You have to trust your doctor, otherwise this is not gonna work. And you wholeheartedly
Yeah.
have to support. So they are doing the science, God is doing their work, and we have to place our trust in them. I think it's just a full cycle.
I totally agree. People are told, sometimes women are told, go lose weight and come back after 6 months. I don't say that.
Yeah.
Because you're actually stressing that woman by telling her to lose 10 kilos and come back. You know what? She's not going to come back in a year, and she's lost so many
Time.
months of her life just by trying to reduce weight. I feel we shouldn't stress our women. My daughter says it's body shaming. It's not, I'm not saying it's, I keep saying exercise to just keep yourself healthy. If you lose weight in the bargain on a fertility journey, that's a collateral advantage.
Yeah, I think that
But
happened with
don't-
my case.
Yes.
We were reducing, and then I started gaining, and then she said, okay, let's stop and let's do it now, because you're not going to lose any further, so let's do it now.
Correct. So what I'm trying to say is it does not matter. No, you just have to strategize based on what you see. And rather than stress the people who walk into your office and tell them, okay, this is wrong with you, this is wrong with you, this is wrong with you. They kind of know there's something wrong. That's why they are in
Yes.
Right,
I
doctor?
so agree with that, doctor. It's
So,
about supporting them through their journey
Yes.
more than anything else.
Wonderful. Thank you to both of you, doctors. We've been chatting for over an hour, at least an hour and 15 minutes. I have my last question to both of you, right? I feel knowing your hormones and understanding them is one of the best forms of self-care. What is your message to every Indian woman in Dubai watching this? Because we will replay this webinar very soon on our YouTube and other channels. What's your message to everybody in this room that they should take away from today's session?
Dr. Sreelatha?
Doctor, you'll go first.
Yes, okay. Well, I'll only say one thing that I keep telling all my patients, that your symptoms are not random, okay? Please listen to your body as your body is communicating with you regularly, all right? And whether it is like, when you understand that how you feel energized or about your fertility or about other things, whether it's perimenopause or menopause, when you start understanding what your body is telling you, then you start seeing the shift. And the shift happens because when you recognize it, you can actually heal the problem. And remember that you're unique. I say this to everyone always. There are no two people who are the same. Okay? You're unique. So you have your health problems also, which are unique to you. And you need to address them accordingly. That's my message to everyone.
Thank you, Dr. Rajul. Dr. Sreelatha.
From the space that I come from, I just add on to what I totally agree that I tell this, we are trained not to listen to ourselves. We're trained to prioritize the husband, the family, the kids, and finally ourselves. I think we should start prioritizing our health first, because if we are there, the rest of them are there.
Correct.
It is like, if you invest in the woman in the house, it's like investing in the entire family. So invest in your own health. Add hormonal health as part of your extended annual health checks. Make sure, how many women actually get pap smears done is actually, very low, the numbers, if you look at it. Have you had a pap smear? Wo kya hota hai? Then you have to explain to them what a pap smear is. So please remember, among the cancers that can be preventable, the single most leading cancer that can be preventable is cervical cancer. And that can be detected with regular pap smears.
So once a year is enough. Yeah.
Yeah, once in 2 years is enough, in fact.
Yes, once in 2 years. If your reports are normal, once in 2 years.
Then make sure that you all know how to do your breast self-examinations, very important. And then coming from the space that I come from, remember, as much as I don't want to, blame age, I'd say is your reproductive health is connected with where you are in terms of age, what you eat, what you drink, and what you reap today is what you sow today, sorry, is what you're going to reap later. So make sure that you're doing the right things. If you've been smoking for 10 years and then suddenly decide you want to have a baby and give up, you can't undo the damage in 2 months.
Absolutely.
So, that is going to take a lot of time. It takes 5 years to undo the damage once you quit smoking interestingly. So, and the same goes to people around you, including if you are with partners. Educate them that what you eat and drink today is what makes you a few years or months down the line. We say बाल सफेद हुए स्ट्रेस की वजह से अरे एग और स्पर्म भी सेल है दिस इज अ नॉन लिविंग स्ट्रक्चर करेक्ट एग एंड स्पर्म इज अ लिविंग स्ट्रक्चर सो वो स्ट्रेस नहीं होते क्या स्ट्रेस होंगे ही ना सो मेक श्योर दैट you're good and kind to yourself, and fertility is a conversation that people should start having more in the open. It's not something to be most of our people. I had a husband cry in my office a few days back because he married his classmates. Okay. Both of them are classmates in university. They married. Then what happened was they are still trying to have, and he hates going to class reunions, alumni functions, everything. The only reason is he feels that he's going to be, there's peer pressure. So, like doctor said, you're unique. Your journey is unique, whether it is in your health or your reproductive health. It's like, आपके password से किसी और की bank account खुलती नहीं है. Exactly like that. You have your own journey. Make sure you're investing in it in the right way. The more mindful way is what I'd like to say.
Thank you to both of you. Thank you so much for sharing your expertise so generously with our audience today. Guys, your health deserves attention, and I think we probably, looking at the response today, we probably need more conversations so that we can turn all the ignorance into knowledge. I promise we'll be back with more such conversations and bring our doctors back very, very soon when we get the opportunity. Thank you everybody for joining us today, and we look forward to seeing you back on IWD.